evening, and good morning, depending on wherever you are. On behalf of International Pharmaceutical Federation, FIP, I extend a warm welcome to everyone, and thanks to those who have joined live and to those who would be listening in later. I also welcome our panelists for today, whom I'll be introducing to you very shortly. We are pleased to be delivering this digital event on enabling multiprofessional vaccine prescribing and administration for improved uptake rates, Southeast Asian region. This is the series of regional events, and this is the 5th event in this series. I'm Mrs. Manjari Gharat from India. I'm the Vice President of FIP, and I'm honored to chair this session with my colleague, the co-moderator of this session, Al Carter, Executive Director, National Association of Boards of Pharmacy, United States of America. Welcome, Al. Can I have the next slide? So most of you are familiar with FIP, but let me just remind you of our vision, a world where everyone benefits from access to safe and effective medicines and pharmaceutical care. FIP is on a mission. Can we have the next slide? To improve the global health by supporting the advancement of pharmaceutical practice, sciences, and education. So welcome again, all of you, to this session. And before we go to the session, let me make some announcements. Maybe you're familiar already with it. This webinar is being recorded and live streamed via YouTube. The recording will be available on our on the website events.fip.org. You're most welcome to ask the questions using the Q&A box. So I just remind you again, ask the questions using the Q&A box and not the chat box. You're welcome to provide your feedback to webinars@fip.org so that we can continuously improve for the future events. And if you're not yet a member of FIP, I welcome you to join this global family of the pharmacist by taking up the membership. So please visit our website for the FIP membership. And also I can add to this that those who have joined us live on Zoom, they will be receiving the certificate from FIP after the webinar is over. FIP would like to thank GSK Biologicals for supporting this online event through the unrestricted funds. Thank you, GSK. So we have the panel of experts for today for this panel discussion. And we have from Sri Lanka, Tisara De Silva. And Tisara De Silva is the registered pharmacist in Sri Lanka. And he also has degrees and diplomas, Master of Business Administration. He has done MBA. He also holds a diploma in Modern Management, UK, and diploma in computer programming. He's currently the president of Pharmaceutical Society of Sri Lanka. He's also the bureau member of Federation of Asian Pharmaceutical Association, FAFA, and he's the council member of FIP. Welcome, Tisara. We have a colleague from Indonesia, and her name is Dr. Keri. Dr. Keri has replaced Nurul Periang, our colleague from Indonesia, at the last minute. Thank you very much, Dr. Keri, for joining us. She is Dr. Keri Lestari, and she is a professor in the field of pharmacology, clinical pharmacy from University Pajajaran in Indonesia. And she has received several awards as a woman researcher, as an inspirational woman, and we are very proud to have Dr. Keri with us. She'll be joining in shortly. Thank you, Dr. Keri, and welcome. Now it is my pleasure to request my co-chair, Dr. Al, to introduce two other speakers. Then I come back to you for the introduction of the webinar. Al?
Thank you, Manjari. The next presenter or panelist for today will be Dr. Rao Balamudi. And Dr. Balamudi is a pharmaceutical professional with 34 years of experience working for various academic institutions and multinational and Indian pharmaceutical companies. He is an active member of the Indian Pharmaceutical Association and is the immediate past president of the association. Rao is currently the president of the Commonwealth Pharmacists Association, being elected for a second consecutive term. He is also the professional secretary of the SEAR Pharmacy Forum, the regional pharmaceutical forum of the FIP for the Southeast Asia. So welcome, Dr. Valamudi. The final panelist will be Dr. Pramod Yao. He is a vice president and acting president of the Pharmacy Council of India. He has also served as a chairman, All Indian Council for Technical Education Pharmaceutical Education Board. He is a member of the Executive Council, All India Council for Technical Education in New Delhi. He is also an Executive Council member of the Mahatma Gandhi International Hindi University, and he is the Mahatma Gandhi International University, also serves on Pharmacy Council of India, and is a member of the Board of Governance for the National Institute of Pharmaceutical Education and Research. Please welcome our panelists. Thank you. And I'll turn it back over to you, Manjari.
Thank you so much, Al, for this kind introduction of our panelists. So today's program, I would be introducing to this program to all of you in a short while. Then we have a roundtable discussion. So today's format is like we are going to discuss with all our panelists some of the questions, and they will be talking about the vaccination in their regions. Then we have Q&A, and for which again I remind you to put your questions in Q&A box, and then there will be conclusion, wrapping up, closing remarks. So before I go to the learning objectives of today's session, I would like to tell you that FIP has been working in the area of immunization and pharmacists since long back. You can see several publications from FIP right from 2011. Just to name few, FIP and WHO published the joint guidelines, Good Pharmacy Practice, Standards for Quality of Pharmacy Services, the administration of medicines, vaccines, and other injectable medications. So that was in 2011. So the FIP continued to publish and to trying to strengthen this role of pharmacists in immunization by publishing several other publications in 2016, 2017, 18, and 19. In 19, FIP, I'll come back to that. Yeah, so in 2019, FIP joined, there was a steering committee of immunization for all ages coalition. FIP joined that, and there was a launch of the FIP Global Vaccination Advocacy Toolkit. And after 2019 came the pandemic. Can I have the next slide? 2020, and that's when the whole world was under the COVID-19 pandemic, and of course we still continue in the pandemic. We still are under the shadow of the pandemic itself. So FIP published a report in 2019 on the immunization and the pharmacist. And then in 2020, as the pandemic progressed, FIP took up the Transforming Vaccination Globally and Regionally digital program. It was delivered in 2020 and was continued in 2021 also. So this was the FIP's first digital transformation program involving a 3-part series of 24 digital events, culminating in a global summit and a FIP commitment to action on improving vaccination coverage through the pharmacists. So we had this very successful series of events on the transforming vaccination globally. Next slide, please. So FIP published a pharmacy-based pandemic vaccination program, regulatory self-assessment tool. FIP launched a second digital program, which was the continuation of transforming vaccination globally and regionally in 2021. And then the vaccination handbook for pharmacists, procedures, safety aspects, common risk points, and frequently asked questions that was published. And all these resources are available on the FIP website under prevention.fip.org. So I appeal all of you, welcome all of you to visit these publications. Next slide, please. One of the reports that I want to draw your attention is the FIP's report on impact of pharmacy on vaccination coverage, which was released in early 2020. And it was the study from the 99 countries, and it was very clear that the pharmacy-based vaccinations are available in 47% of the high-income countries, compared with just 11% of the low-income countries. According to the report, community pharmacies give almost 1.8 billion people around the world the possibility of being vaccinated. The report clearly shows that increased vaccine accessibility and coverage have been demonstrated in countries where pharmacists have the authority to administer vaccine. So this is really a clear evidence how much the role of the pharmacist is in the vaccination. And in those countries where still the role has not got developed, FIP has been supporting these countries by way of advocacy tools, by way of writing the letters along with the member organizations to the government, to the Ministry of Health in those countries, so that they also realize the importance of the role in immunization. Next slide, please. And as I showed you before, this is the Global Vaccination Advocacy Toolkit, which will be really helpful to all those countries where the pharmacist role has not yet got developed in vaccination. So with this background, we come to today's regional event. So the learning objectives for today's event: at the end of the event, participants should be able to identify the drivers and the barriers related to the regulatory landscape of vaccination in the region, learn about examples of best practices in terms of interprofessional cooperation and task sharing involving pharmacists in the area of vaccination, explore the plans for switching from a pandemic to an endemic response in the region, including the role of pharmacists in vaccination and in patient care and treatment. So now, with this background and making clear the learning objectives for today, I would like to discuss So I welcome the first panelist, Tisara De Silva from Sri Lanka. If Dr. Carey is not yet available, then we can go to Sri Lanka. And I would like to ask questions and discuss with Mr. Tisara De Silva.
Hi.
Hello, Dr. Carey is
good morning, good afternoon, depending on the area where you are. I'm Tisara from Sri Lanka.
Yes. So can I go ahead and ask you the questions? Yes. Can you please name? I know you're representing Pharmaceutical Society of Sri Lanka. So name of your organization. Did I say it correctly? Pharmaceutical Society. And so I will have a few questions for you, if you don't mind. Is there a need to improve the vaccination coverage rates across all ages in your country? Is there a need to increase the vaccination coverage rates? In general, we are not talking about COVID-19, but in general, the immunization rates in your country.
No, now starting from birth, say after the second month, fourth month, 6th month, 9 months, 12 months, and 18 months, and onwards, we do have a very sound vaccination program, which is the National Immunization Program. It is 100% funded by the government through free health in Sri Lanka. It is not open to the private sector. It is 100% done by the government. So starting from that, the very first on birth, where you give the BCG onwards, the vaccination program is there up to school entry and even after school entry. And then if you take the next steps, the vaccines outside the National Immunization Program, which say covers the rotavirus, hepatitis A, hepatitis B, then the HPV, also influenza, typhoid, and varicella vaccines are available outside the National Immunization Program. So that is opened for the others. So,
right. And so the location of this vaccination is mainly the government hospitals or the government centers?
Yes. Yeah, the starting point is obviously the government hospitals and also the private hospitals where you get, you give the BCG at birth. And even in the private sector, the BCG vaccination is given for all children. So it's the government sector plus the private sector. The BCG vaccine is given.
And
but
is there
it is 100% sponsored by the government.
So government is the funding
through the
agency.
National Immunization Program.
Right. Yes. So, is there any role for the pharmacists yet in your immunization program? Has government included them in the vaccination for any kind of role? I mean, not only the administering, but maybe for awareness or.
Yeah. Now, unfortunately, in Sri Lanka, pharmacists do not get involved in administering any vaccine at all.
Yes.
But we do get involved in various other stages. Now, for administering, it is handled by either the medical profession or the nursing profession. So it's pharmacists are not involved. Then, if you take the other sectors where the pharmacists get involved, now, for example, any product has to be registered first. Any vaccination has to be registered. So then, submitting regulatory dossiers to the NMRA or National Medicines Regulatory Authority is done by pharmacists of companies. So various companies do recruit pharmacists as their regulatory officers. So they get involved in registering vaccines. Then if you take the NMRA, the evaluation part is initially done by the NMRA pharmacist. So they get involved in registering or scrutinizing the dossiers submitted by companies. So pharmacists do get involved in that process. And also after approval, pharmacists do get involved in storage of vaccines. Yeah.
So they are made in the logistics and the supply chain.
So the entire supply chain process, starting from storage, distribution, all that, the pharmacists get involved because they are employed by various companies to get involved in this vaccination supply chain process. But administering is done by the medical and the nursing profession. Pharmacists do not get involved.
This is the picture, I think, in the almost the entire part of the region that we would know. So my question is, if you wish and if the your organization is willing to have the pharmacy-based vaccination program, that is the community pharmacist in administration of vaccine, how can FIP assist in creating or enhancing a pharmacy-based vaccination program in your country? What way they can help? I said that there is an advocacy tool developed, as well as the FIP has been writing to the governments along with the member organization. So what is your view on this? What else
it's
FIP
like this.
can do?
Yeah, then firstly, the national policy has to change, because as per the current practice and the policy, pharmacists do not get involved in administering. So the policy of the government has to change. For that, the NMRA, the National Medicines Regulatory Authority, and the epidemiology unit of the Ministry of Health, they will play a key role in implementing this pharmacy-based services. So right now, because we don't have that system, if FIP wants to get involved and support the pharmacy-based vaccination program, then we need to address or speak to the NMRA and the epidemiology unit of Sri Lanka and the Ministry of Health, and convince them and see whether we could arrange this. But at the same time, we need to provide, or FIP has to organize some training programs for pharmacists on administering the vaccines, because these pharmacists are not trained to administer a vaccine. So separate training program has to be done simultaneously. Have to discuss and convince the NMRA and the government and the epidemiology unit of Ministry of Health that in other countries, pharmacy-based services are there.
The evidence,
and,
the global evidence.
We have to provide evidence, and then we have to train the pharmacists and see whether we could implement that in Sri Lanka, which is a gigantic task, I believe.
Yes, I understand. So the regulatory changes are needed, as well as the changes in the education and training policy are needed, where the FIP can assist and support Sri Lanka and the region. So thank you very much. Well said, De Silva. And I'll come back to you, or I will come back to you with my other questions if we have towards the end. So thank you very much for your insights. Yeah.
Thanks. Thanks, Manjari.
Thank you. Welcome, Professor Kerry. Professor Kerry from Indonesia. Professor Kerry. I would like to discuss now with Professor Kerry. I think she had joined. Yes, Professor Kerry. Welcome again.
Yes, I'm here.
And
yes,
thank you very much for joining. And really appreciate you joining the last moment. So really appreciate that. Thank you very much. I would like to discuss regarding the pharmacy-based vaccination. Yeah. Can you hear me? Hello, Professor Kerry. Can you hear me?
Hello. Yeah. I cannot hear you, so I try to find the good network. So
okay.
Sorry for the obstacles. Would you like to repeat your question?
Yes, I would. In fact, I did not ask any questions yet. So I'm starting here. So you're perfectly fine. So I just wanted to ask you initially, in Indonesia and in your region, is there a need to improve the vaccination coverage rates of all ages? So is there a need to increase the vaccination coverage rates in Indonesia?
Yeah. Okay. For the vaccination coverage rate in Indonesia, is already covered the children ages from the senior citizen. The age is not limited for the senior citizen. The coverage is already cover all the I think like, but for the infant, this vaccination, not COVID-19, that I already mentioned before, is for the coverage of the COVID-19 of children, and then until the
do you have pharmacy-based vaccination in Indonesia, or have you started? I mean, has been there any initiation for the pharmacy-based vaccination? That is the vaccine administration through the community pharmacies.
Yeah, in Indonesia also the vaccination. Sorry, maybe a host is disabled my video.
That is
so
perfectly
I cannot
fine.
Open my video.
No, that is fine. And if you have internet issues, it's nice to switch off the video because you may get better bandwidth. So that you're perfectly fine.
Okay, good. So, okay. I repeat my answer.
Yes, please.
So that Indonesian coverage, the vaccination coverage is already cover all ages in Indonesia, since the infant until the senior citizen. And then and for the COVID-19 in Indonesia also cover for the 6 years children until the senior citizen also. There is no limited ages for the senior citizen. And the other things is how about the coverage of our population vaccination? our population is already, our vaccination is already cover 70% for the first vaccination of the COVID-19. And for the second dose of the vaccination of COVID-19, we still try to enhance the number more than 50% now, but I think it's still going on from the progress of the mass vaccination for our population to get the herd immunity. There is the vaccination of Indonesian population. And the other things also, the pharmacists has also has some activities in program of the vaccination, such as for the distribution of the vaccine, and then to vaccinate it also sometimes if needed, and also for the preparation of the vaccine before they deliver to the site on the vaccination. I can have your question, but correct me if there are any question that I didn't answer yet. Thank you very much.
Thank you, Professor Kerry. So I understand the pharmacists are involved in the storage and in the preparation of the vaccines. That's right, right? Are the pharmacists in Indonesia administering the vaccine through the community pharmacies? Are they injecting the vaccines? Any vaccine? I'm not referring to COVID-19.
Yes.
So yes, so yes, it's already happening in Indonesia.
Some of the Indonesian, some of trained pharmacists in Indonesia also administering the vaccine, but not all the pharmacists in Indonesia. The ones of the pharmacists who has rights to
administer,
administer the vaccine.
Okay. So is vaccination included in your education, the undergraduate education? And is vaccination included as a part of the undergraduate curriculum in pharmacy?
I cannot hear you clearly. I'm sorry. Hello?
Is vaccination included as a part of undergraduate curriculum of pharmacy?
Would you like to repeat your question?
In your undergraduate pharmacy program, is vaccination included? Are students taught how to administer and the risk involved, ADRs, and so on? Professor Kerry, maybe we will come back to you after some time because there might be, I think, looks like there are some internet issues. So no problem. We will come back to you after a while. Thank you very much. Can I go to Al? Al, can you now take over and discuss with Dr. Rao Vedlamuri? Thank you very much.
Thanks, Manjeri. Dr. Valamoody, how are you?
I'm good. How are you?
Doing well. Thank you again for participating as a panelist today. And I'll start off with the first question for you, and to really discuss: is there a need to improve vaccination coverage rates across all areas or all ages in your country and region?
May I repeat your question? Is there a need to improve vaccination coverage rates across all ages?
Correct.
In our country or the region?
Correct.
Okay. So certainly there is a need to improve vaccinations. In a country like India, vaccinations have been the mainstay for mother and child care during delivery and pregnancy, and all the childhood vaccinations, all the infants and the children are growing up, they are very well vaccinated. So vaccinations have eradicated diseases like smallpox, to a great extent polio, okay, and also several diseases like diphtheria, whooping cough, etc. Nevertheless, when it comes to adult vaccinations, not too many adults are really vaccinated. Sometimes we use the tetanus toxoid. Whenever there is some injury, that's where we do the vaccination. But hepatitis B, A, and influenza, and many other vaccines, typhoid, etc., are not a part of the drive of vaccination. It depends upon the patient's awareness, the doctor, and the inquisitiveness or willingness to take vaccination. However, in my mind, adult vaccination should be improved in India. There should be an advocacy, and people should be vaccinated against tropical diseases and all other diseases that adults suffer. So that there's a tremendous need for improving that vaccination coverage. The pandemic has given a tremendous awareness for people to get the vaccinations. Okay, but that is pertaining to COVID vaccination. But how about flu vaccines? People should be covered flu vaccines. So vis-a-vis Western world, these vaccinations, the coverage in India are pretty low. And bottom line, yes, there is a tremendous need to improve vaccination coverage rates.
And who are the main providers? Do pharmacists provide vaccinations in India, or is it specifically physicians or others that are providing vaccinations?
See, the vaccinations in India are usually carried out at the primary health centers and special drives and camps, and in child clinics and the maternity hospitals. So most of the time, the providers, if you're talking about vaccinators are usually doctors, nurses, and other healthcare professionals, what we call. Very rarely pharmacists are involved in administering vaccination, although they play a tremendous role in the development, approval, and supply chain and supplying it to the public. But it's also, if you take a cross-section of various pharmacies in India, you will find that vaccines are available in pharmacies that are situated close to places where vaccinations are made. But if you just walk into your pharmacy and ask for a vaccine, probably it's not available, So this is the situation. And in the recent times during COVID vaccination, preparatory to COVID vaccination, Government of India has notified who can vaccinate. And in that list, thanks to FIP's advocacy and Indian Pharmaceutical Association's letters, government has notified that pharmacists are vaccinators. Okay, that means they're authorized to vaccinate. But is it only pertains to COVID vaccination or any other vaccinations? It's not very clear. But at the same time, if the vaccine is as a nasal vaccine, as an oral vaccine, where the administration can be fairly easy, but then if it is intramuscular, transcutaneous, or subcutaneous, intradermal kind of thing, a training is needed. And that training may be available to certain pharmacies and certain pharmacists, but not across the country, because there are more than 700,000 or 1 million pharmacies in India. So there are that many number of pharmacists are there, but maybe a tenth of them might have been trained. I would also think that in the hospital pharmacy, probably those hospital pharmacists are more involved in administering vaccines, but to a less extent relative to the other healthcare professionals.
If the training was available more readily, is there any other opposition to pharmacists, say at some of these pharmacies, providing vaccines, especially as you mentioned to adults, where there's a challenge with increasing the rate of vaccinations for adults?
I don't really think there would be an opposition from other healthcare teams or vaccination providers, because If the job is done by somebody else, they would appreciate that. Because usually vaccinations are through vaccination drives. So that means this week we would vaccinate so many people, so many children, in this particular region. Or in the PHCs, that's primary health care centers, and in the child and mother, care centers, there can be a rush. There can be a tremendous demand for vaccinations, and there are too few vaccinators. So there are usually people lined up to get the vaccinations, even childhood vaccinations. So certainly somebody chipping in and helping to vaccinate people, that is of great help to improve vaccination rates across the country. But there's one more aspect also. There is some vaccine hesitancy. Many a times people go and then say that your child needs to be vaccinated, and then they convince people to get their children vaccinated. But if pharmacists are involved, probably they would increase the compliance with vaccinations, because they will be talking to patients and people about vaccinations. So I see a tremendous role for pharmacists in improving the coverage of vaccination. But we have to start the ball rolling, whether we wait for the government to put the system in place, or we get the system in place by convincing some pharmacists to operate vaccination clinics. Because if they are authorized by the government, I think they are, we could further consolidate that through a legislation. But I think that would help in a multiple ways, in a multifaceted way. One, it decreases hesitancy, it increases vaccination coverage, and it covers more people, and ultimately reduces disease burden. So this is the rosy picture if pharmacists are involved. I strongly believe in that.
Interesting. Thank you for that information. I'm going to ask you one more question, and based off of some of your responses you've provided here thus far, in regards to what you just mentioned and how pharmacists can be so much further involved, I think, in advocacy, but then also in the administration of some of these vaccines. Are there any plans based off of the pandemic, transition from pandemic to endemic response, and the role that a pharmacist can play here? Are there any plans to move forward in that direction? And then, a question I'll ask to you that you can answer now, but then I'll ask to Mr. De Silva and Professor Carey as well, is there a place where FIP can assist you in those efforts? So I guess first, is there any plans to move there to, with the pandemic and what everyone has done, especially pharmacists for COVID, to help show that pharmacists can do more in this space and to lead further discussion, potentially training access to this for pharmacists in India?
Certainly. The scenario can be looked at from two different perspectives. One, it could be a push from the pharmacist associations and FIP, as well as the pharmacists, to ask for more role in vaccinations or immunization. This can be done through, advocacy, pound on the government, and also demonstrate that wherever pharmacists are involved, the vaccination take rates are higher, okay, and population are better covered. And even pharmacists can be involved in epidemiology to see that how the vaccines have actually affected the population. Groups of people who received vaccinations, whether they have lower incidence of disease compared to groups of people who have not received the vaccination. This epidemiological study. So far, in the COVID pandemic, government is driving the vaccination because they are tasked with delivering about 2 billion doses of vaccines, because this eligible population for vaccination is about 1 billion and 2 doses per individual. And government has set up separate centers and recruited or deployed so many healthcare professionals or alternate healthcare professionals, doctors, in achieving this mountainous task of vaccinating. In about a year and a half, year and a quarter, India has achieved in delivering about 1.4 billion doses of vaccines. Okay. Now, if you really take a cross section of the statistics and look at the involvement of pharmacies and pharmacists, probably very little, But if the government has empowered 700,000 pharmacies in the country and, introduced training for them, then the task would have been much easier. Because instead of setting up new centers, many pharmacies in many cities can be authorized to vaccinate, and the pharmacists would be readily available and people would reach them. So that's a scenario that we have to actually project to the government in saying that this is the benefit, and you have this manpower, but probably in need of a training, which probably an organization like FIP or any other organization, along with the local organizations, can provide this training. And thereby you can train and deploy these manpower. The pharmacists are already very well versed with vaccines and side effects because it is a curricular content. So they study that. But they kind of forget that because they're not involved in vaccination. So they are only storing, right? And storing and dispensing against a prescription. That would really do great help for the government's programs of covering the entire population on immunization. Now, the government has a tremendous task of spreading immunization awareness across the population, not just COVID, but other vaccinations. So that would be absolutely the right scenario. Now the question is whether the government would pull these pharmacists into their fold, or do the pharmacists, along with the pharmacy professional organizations, push the role of pharmacists into making government realize that. So it is kind of a government-induced pull, or advocacy by professional organizations and pharmacists, the push. In India, I think the push works more than the pull, because the government tries to do things with not taking into account pharmacists. It has happened in the past. We know that it continues to happen. So we continue to advocate. But if pharmacists are involved, then the scenario would be very different. The coverage rates of immunization in adults would be tremendously high, and the disease burden would be tremendously low. This is my sincere feeling.
Thank you, Dr. Valamudi. That's great insight, and thank you for sharing your perspective. We're going to alter from today. Dr. Pramod has just notified us that he is not going to be able to join us, and he sends his apologies. And so at this time, I'm going to ask Mr. De Silva and Professor Carey to also open up to turn their cameras on and to hop back on. And what we're going to do is I have a question for all of you, and then we'll take questions from the audience and those participating to see if there are any questions from them. And so I guess my first question to each of you, and Dr. Rao just answered this, is Mr. De Silva, how can FIP assist in creating or enhancing a pharmacy-based vaccination program and the overall pandemic and endemic response to COVID in your country?
Yeah, in my earlier, I hope you can hear me.
Yes.
Right. In my earlier speech also, I said that pharmacists are not involved in administering any vaccines. So FIP will have to join hands with the professional association, which is our association, the Pharmaceutical Society of Sri Lanka, and try to convince the National Medicines Regulatory Authority and the Epidemiology Unit of the Health Ministry to include the pharmacists, or to expand the role of pharmacists in getting involved in vaccination. So as it is not practiced at the moment, if you take the COVID vaccination program in Sri Lanka, the COVID vaccination program is 100% controlled by the government. First dose, second dose, and even the booster dose. It is done only at the government centers and also public centers managed by the military medical division. So it's 100% COVID vaccination is done by the government. It is not open to any private hospital or private center. So therefore, the involvement of pharmacists is zero. As I said earlier, to increase the role of pharmacists in vaccination, we need to convince the NMRA and the Epidemiology Unit of the National Health Ministry to expand their role, because if you take the population of Sri Lanka, it's about 22 million. And if you take the COVID coverage, only in the main outside the capital, Colombo, if you take the suburbs and in the other districts, COVID vaccination is done only in hospitals. Only in Colombo, you get in certain public places where the military is involved, in military medical division is involved in vaccination. So we can expand the vaccination program if pharmacists are included in the suburbs, because in Colombo it's handled well, and in the outstations it's done purely by the government hospital vaccination centers.
Thank you, Mr. Silva. I have another question for for all of you, and Professor Carey, I'm not sure if you can hear us, but if you can, this question will be to the three of you. Can you, I guess one at a time, can you describe for us any examples of best practices from your country in terms of interprofessional cooperation and task sharing involving pharmacists in the area of vaccinations and potentially in the area of regulatory frameworks? And Dr. Rao, we'll start with you.
Okay, you're saying the best practices.
Yeah.
In involving pharmacists.
Correct.
Yeah. Okay. What can be a best practice? I think in my mind, if there is a practice of involving pharmacists in vaccination programs, then what's the best way of involving them? It would lead to best practices. So initially, we have to start with the practice of using pharmacists, and that's not very much in place. Like I can echo what Tisara was saying in Sri Lanka. The same situation in India too. In some corporate hospitals, when they are given the task of delivering COVID vaccines, probably the corporate hospitals might have employed their pharmacists as vaccinators. Pharmacists are authorized to vaccinate. This particular point came up only in a letter dated October 2020, preparatory to COVID vaccinations. So prior to that, pharmacists are not involved in actually delivering vaccinations, or administering vaccinations. So the best practices would be, yes, certainly we have to develop the training programs and train the pharmacists and certify them. And the certificate would also certify the pharmacists in where they are working. Then the notifications would come that this pharmacy is authorized for vaccination because the pharmacists have undergone the required training, and they are certified. This is the first thing to be in place. In my mind, is the practice. So that's where it starts. But for that, it is a question of who will start this ball rolling. Would we wait for the government to do it, or would we advocate to the government? We continuously advocate to the government about the role of pharmacists. Mind you, there is some resistance from certain pharmacists to get involved in this role, because in India, majority of the pharmacists in pharmacies, they are more like, business people. They're selling medicines, but that selling is against prescription, right? So the best of the best dispensing practices have to be put in place. Then the pharmacist would understand that there is a role to dispense each medication under advice. And one of the medications that they could dispense as well as administer is vaccines. That's how the process has to start. We cannot achieve that in a year or two, but continuous efforts, from both pharmacists and pharmacy associations, with the help of international associations, I would say, like FIP or Commonwealth Pharmacists Association, where I'm president of the association. These having a dialogue with the national health authorities, whatever that is, and then convincing them, that involvement of pharmacists would improve the vaccination and vaccination take rates. This is very important, And say, for example, if we put in immunization, influenza vaccine, and it's not for lifelong. In India, there's a concept that you take the vaccine once and you will forget it. But influenza vaccines have to be taken each year, right?
Right.
And that is necessary to keep the people in better respiratory health, such that they can work better and that there is more productivity. And that understanding has to be brought into public, and there is a tremendous advocacy role, and that role pharmacists can perform. So in my mind, all this put together can evolve into a situation where pharmacists are immunization pharmacists, and then we can set up the best practices. That's how I look at it.
Would physicians or the medical doctors, would they be supportive of that? Pharmacists entering into this space to assist with providing vaccinations and his education and advocacy efforts? Would you see a combined effort to work on that?
I would certainly think so, because there is no physician or no clinician is actually sitting idle waiting for patients to come such that he can vaccinate them. Okay, it is an additional task for him, right? And to receive my COVID booster, I went to a corporate hospital, and then there they sent me from one department to the other department to a particular cell where it is you will get vaccinated there, because they don't want that to come in their main business. What is that business? Is treating patients. So getting a vaccination to a normal individual, he's not a patient, and the hospital is not making any money. It's just, you pay for vaccination. And if such roles are shared by pharmacists, why not? I think they can focus more on their business, which is diagnosis and treatment of patients.
Mm-hmm.
Just as a sideline, I want to add, maybe in a couple of minutes, one example. PharmD, which is more of a clinical-oriented program, is very recently started in India. It's about 10, 12 years ago. So during the PharmD training, the students spend 2 years in the clinic, 5th year and 6th year. I personally talked to the doctors in those multi-specialty hospitals where the students are working. And each doctor is very, very, very happy with these, PharmD interns, because they are taking 50% of their task and they're doing effectively such that the doctors can focus more on treatment and other procedures rather than explaining about drugs and looking at the drug charts and see what is happening, or looking over the shoulders of nurses. And their doctors very clearly said, we want the pharmacists. If that is the case, then I extrapolate that to a vaccination scenario. I think doctors will feel that it's a burden to vaccinate so many people in addition to their regular job, and pharmacists stepping in would certainly improve the entire healthcare scenario.
No, thank you. It's
Carter, can I share my experience with you?
Yes,
on
please.
the same topic? In Sri Lanka, the situation could be slightly different, because if pharmacists are permitted to get involved in administering vaccines, there will be resistance from the medical profession, because the medical profession in Sri Lanka are continuously objecting to pharmacy education upgrading. And even the university system, when Sri Lanka started the B.Pharm degree program, it was initially it was 4 years. The medical profession got involved, intervened, made objections, and brought it down to 3 years. Then finally, after so many years only, it got back on track. So the medical profession in Sri Lanka will not be comfortable in the pharmacists getting an extra role and expanding their role in this system. So I feel that there could be resistance from the medical profession. We're not only administering, say, COVID, any other vaccination, because right now, no vaccination administering is done by the pharmacists. If you take the COVID vaccine situation, I said even in the suburbs, it is done by the government through the hospitals as well as through the MOH divisions. It is also through the government sector, where the public health inspectors get involved in vaccinating people or giving vaccines for COVID. So other than the medical profession and the nurses in the hospital, the third force who are involved in COVID vaccination in Sri Lanka is the public health inspectors. So not pharmacists. So pharmacists, expanding the pharmacist role is not going to be easy because there could be resistance. Even as I said earlier, the medical profession have got involved and intervened in upgrading pharmacy education. Very unfortunate situation, but that's the true story here.
Yeah, that is a very unfortunate situation and circumstances. And thank you, Mr. De Silva, for sharing that.
Al, can I add something there?
Sure, go ahead.
Yes, it's not a debate or it's not a counterpoint, but in certain Asian countries, doctors are not really interested in pharmacist expansion role, because in countries like Malaysia and certain other countries, they even want to do the dispensing, So separating prescription and dispensing is also a problem for pharmacists, because many times doctors, they dispense the medications, prescribe and dispense. So that means they keep the medications with them. The role here, what I'm trying to say is that, if doctors are really involved in vaccinating, administering the vaccination, in India, I saw only probably certain child specialists directly vaccinate or administer vaccines to infants. But most of the time, they ask their staff, like an assistant or like a nurse or like a trained paramedical person, to administer vaccines. So why should they have any problem in pharmacists administering it, unless they feel that pharmacists are competing with them? In reality, both the professions has to go together. One is an expert in diagnosis and treatment. The other person is an expert in medicines, and whatever diagnosed and whatever prescribed, the pharmacist would enhance that through his knowledge. So these things go hand in hand together. Somehow in the SEAR region, Southeast Asian region, we have to advocate that role also, that pharmacists, empowered pharmacist and a doctor put together can form a better healthcare team and give tremendous, benefit, value to the public, so the healthcare system would be much better. So this is a very, very idealistic thought of mine, because I'm very clear of these issues. Some places even doctors say that pharmacy should not be there. But at least by far in India, pharmacy as a profession has been recognized, and they don't mind if we. In fact, Manjari can support me, because AMA, that is IMA, Indian Medical Association, and Indian Pharmaceutical Association worked together at one time to improve, to work together towards, fight the fakes or fight the spurious drugs. So over a period of time, this collegial relationship would develop in my mind. Thank you.
Thank you, Dr. Rao. Professor Carey, I'm going to ask you the same question to give some feedback from your side. And can you describe any examples of best practices from your country in terms of interprofessional cooperation and task sharing involving pharmacists in the area of vaccinations?
Okay, thank you for the opportunity. In Indonesia, not all the pharmacists has the rights to administer the vaccine. Just the trainee pharmacists can act as the administering of the vaccination. And then in the training of the pharmacists, we are collaborate with the medical doctor also. And then in terms of the distribution and then in terms of the preparation of the vaccine, pharmacist has a good collaboration with the medical doctor and then also the nurse to preparation. But the distribution of the pharmacist is from the pharmacist practices. But if the vaccine is already has to prepare for the vaccination, so for the preparation has the collaboration with or both of the medical doctor and also the nurse and then also the pharmacist. But for the administer the vaccination, not just from the nurse and then also the medical doctor, but since the COVID-19 vaccination, the pharmacist also has the opportunity to administer the vaccine of the COVID-19 truly from the specialistic training for the administrative vaccination pharmacists. And for the collaboration also to develop the vaccination in Indonesia, also pharmacist is involved on the research to the Indonesian vaccine of the COVID-19 and other vaccine also, such as in the government industrial of the vaccine. Many of pharmacists is involved in the vaccine industry, like a Bio Farma in Indonesia. There's owned by the government. Also, there is not just the medical doctor who involved in this research of the vaccine, but the clinical pharmacists, also the pharmacologist pharmacists and the bioclinical pharmacist is involved in the development of the vaccine also. So the collaboration is start from the production, distribution, and administering the vaccination in our country. Thank you.
Thank you. Professor Carey, I'm going to stick with you. I have one more question for you. And Mr. De Silva kind of hinted to this in Sri Lanka as to some of the resistance from prescribers potentially. Do you see any resistance in Indonesia with
some of the prescribing is also we find the resistance also, but after we communicate and then we try to elaborate the collaboration. So slightly there are we have the understanding each other that also this resistance release, but not at all, I think, like that. So it needs time to convince them that pharmacists also has the competencies to administering the vaccination. But with this disruption about the COVID-19 pandemic, so the opportunity is open for the pharmacists, because we need to enhance the numbers of the vaccination in the limited time. So the numbers of the healthcare provider who can administer the vaccine is limited. With our population ratio is quite high, so that there is the window time to pharmacists in Indonesia become as the vaccine administering in this area. That's why I think this pandemic COVID-19 opened the opportunity of our pharmacists in our country to also has the competency in the injection administering. Maybe something like that.
Gotcha. No, thank you so much, Professor Carey.
Thank you. Thank you.
I'm going to see if there are any questions from the audience that anyone would like to ask our panelists here today. And if not, I'm going to turn it back and say, to each of you, any final remarks or thoughts in regards to this discussion today within the regulatory framework and how pharmacists can be more involved, and then how FIP can advocate and support or use some of their initiatives to assist you in your country. And so, Dr. Rao, we'll start with you for any final words, and then we'll go to you, Professor Carey, and we'll finish with Mr. De Silva. So, Dr. Rao, to you.
Thank you, Al. Certainly, FIP can do a lot in the sense that FIP is now actually asked us for the regio-specific development goals, and some of them they include immunization training, and other types of goals. So FIP can help the member organizations and regional forums to develop strategies to increase the importance of pharmacists in the government's minds. And actually, pharmacists are a readily available, very well-trained human resource. And many governments don't see it from that point. And then many a times they start reinventing the wheel whenever they come up to a crisis. So through the help of FIP and the local organizations, if we can advocate very clearly, saying that here is a tremendous resource. Even WHO points out that, when correctly deployed, in your national health policies and national health drives and vaccination drives, you can achieve better results than, starting from scratch. This is what is important, and this probably getting into certain political agendas and ensure that, the government has the political will to change these things, for that lobbying is necessary. But all that, if FIP along with the member organizations or the regional forums can achieve that, results would be very clearly much faster apparent. But so there should be a strategy developed to implement these in the countries and in the regions where they lack.
Thank you, Dr. Balamudi. Professor Carey, to you, any final words and thoughts on pharmacists in the space of vaccinations and how FIP could assist?
Yeah, maybe FIP also can launch some guideline to become pharmacists as the administration for the vaccination. The guideline, I mean, it is for the guideline for the training, and then also with the guideline for the training, pharmacists for the administering the injection, it makes some idea that pharmacists also have the competence for the administering the injection. We need that because some of the resistance maybe can be reduced by the guideline like that. So with this guideline also can help all the pharmacists in the world can administering with properly, and then also with due to the guideline, all the pharmacists in the world can be as the administering pharmacy with the good and proper procedure. And then maybe this is one of the FIP can do for supporting the pharmacists in the world can become the injection administering, and then after that can also have the collaboration multidiscipline with another healthcare professional. And then thank you for this kind of the time for the discussion like that. I think this event is very valuable for us to discuss, and then also brainstorming about some of the problem in the pharmaceutical practice. So maybe I hope that FIP also can enhance this event more routine, maybe to provide the meeting with other pharmacists around the world to discuss about anything that can enhance the pharmaceutical practice and support the multidisciplinary practice with another healthcare provider. Thank you so much for this opportunity.
Thank you, Professor Carey. Mr. De Silva, I'll send it to you for final remarks and the same question.
Yeah, now initially I said that pharmacists are not involved in the vaccination administering process, but certainly FIP can get involved and do join hands with the professional association, the Pharmaceutical Society of Sri Lanka, in training the pharmacists in vaccination and vaccination administering, because nobody can object for such training programs. So if we initially join hands, FIP and the Pharmaceutical Society of Sri Lanka, and if FIP can provide resource persons, and if FIP can conduct training programs for the pharmacists both in the hospital sector and in the community sector, and train the pharmacists first, and then we have a set of pharmacists who are trained in vaccination administration. Then after that, we can approach the government and the National Medicines Regulatory Authority and the epidemiology unit of the Ministry of Health and say, yeah, look here, now we have done the training for the pharmacists. So our pharmacists are well trained now. So therefore, pharmacists should get involved in vaccination and administration vaccine administration process. So we can probably convince the government to accept and to expand the role of pharmacists in getting involved in administering by training them properly first. So if FIP can get involved in training the hospital and community pharmacists of Sri Lanka, and then once we have a well-trained a set of pharmacists, we can approach the government and try to convince the government. And I do agree with Professor Carey that if FIP can have a standard guideline worldwide in setting up how vaccination should be done and how the pharmacists could get involved and the role of pharmacists, and a clear set of guidelines for the entire world. And then if FIP can make use of that and train the Sri Lankan pharmacists also as per that guideline, and then we can always say that our pharmacists in Sri Lanka also are well trained by FIP, we can say, by FIP, resource persons, and it is done as per the set guidelines by the FIP. So therefore, we request the local government or the Sri Lankan government to accept that we do have a already trained pharmacists in Sri Lanka, and for them to get involved or to enroll them or to expand the role of pharmacists in getting involved in vaccine administration. So the training part should be done first, then part 2, we can negotiate with the government. So that is what the FIP could do, get involved in training and funding also, probably because it's an island-wide training program. We as the Pharmaceutical Society of Sri Lanka are willing to join hands with the FIP and conduct the training on administering vaccines for the hospital and community pharmacy sector. Thank you.
Thank you, Mr. Silva. And I do know that FIP is currently developing some reference guides on the knowledge and skills required for, vaccine-related roles for pharmacists. As Gonzalo specifically stated in the chat, that this is going to be launched in the June-July timeframe. So at this time, on behalf of FIP, FIP staff, Manjeri, and myself, I want to thank the panelists again, so Mr. Silva, Professor Carey, and Dr. Valamoody, for your time today. And so would everyone please assist me in recognizing the three of them and thanking them for their time and input and perspective as it pertains to this important topic with pharmacist immunizations and vaccination administration. At this time, we will conclude the session for today. Again, I thank everyone for their time to participate. Make sure to go to events.fip.org for all future digital events in relation to FIP as we continue to focus on trying to unite pharmacy around the globe. I thank you again for your time today, and I hope that everyone has and enjoys the rest of your day, whether it's morning, night, or afternoon. Take care.